Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Pancreaticoduodenectomy, and we're looking at the complications. So we'll look at the complications from the higher to the lower side. So the first complications will be the delayed gastric emptying. So delayed gastric emptying. So this is going to be the very first complication, which amounts up to 18 to 20%. Then comes the pancreatic fistula. So pancreatic fistula, it amounts to about 12%. Then comes the wound infection. The wound infection is about 7. Then the intra-abdominal abscess. This is 6%. Next is, there are some cardiac events. This is 3. Then bile leak is also present. Bile leak. This amounts to 2. And the overall reoperation. So there is also the term that is overall reoperation. So overall reoperation is going to be 3. So let's recap. So the topic we saw was complications following the pancreaticoduodenectomy. So it includes the delayed gastric emptying, which is the maximum about 18%. Then the pancreatic fistula, it can be seen in terms of about 12%. Then the wound infection is seen in about 7%. The intra-abdominal abscess 6%. Cardiac events 3%. Bile leak 2%. And the overall reoperation, this is about 3%. To learn and grow daily like this, please do subscribe.